Facetite that we talk about is pretty straightforward. We've known as surgeons for a long time that when you apply heat to tissue, the tissue tends to contract. In fact, that's how I reduce the fat pad in the upper eyelid, by just gently applying heat when I'm doing the procedure, and the fat contracts. We know this also as I use this analogy often, when we put a steak onto the grill, that fibroadipose tissue contracts based on the heat, and of course that contraction is irreversible, so therefore the results are permanent. This is the Facite handpiece, okay? So if you look at the tip, it's tiny, it's like a needle, okay? When you come in, we numb the area for treatment and we insert this underneath the skin. This is the electrode that sits on top of the skin, like so. This makes sure that the external temperature is checked, which in this case, we've put the cutoff at 35 degrees and normal body temperature is 37. So before it gets to coming close to injuring the external skin, the machine automatically cuts off the heat. We do this several passes. Internal temperature in this case is 66, but we can go up to a little bit higher than that, depending on the tissue type. So if I'm working around the eyelids, then I bring it a little lower. If I'm doing the jawline contouring, I go a little bit higher. So skin tightening is the primary focus of this treatment. The secondary one is fat remodeling. Obviously, you can imagine as heat is delivered to the fat cells, they implode and the fat cells contract. Then you have the fat cells that have these fibril network connections to the overlying skin that contract as well, and that pulls the skin in. So by inducing this little contractions all along the areas that I designed, let's say in the case of a facelift, along the jawline and in these vectors that go back and up, then you can predictably cause tightening of the skin using this technology. This technology also cauterizes, okay, based on, again, that heat, so the amount of, not swelling, but the bruising is minimal because you don't have much bleeding with it. It's very comfortable. We do it here in the office. You use the Pronox, which relieves any anxiety you might have beforehand and will give you an anesthetic that makes this completely painless. Embrace, which is a clever name because you're essentially embracing the skin using the Morpheus8 handpiece externally and the Facite internally, is kind of you can think of it as a comprehensive skin tightening modality. By combining the radiofrequency modality, which is that heat energy, and microneedling, the Morpheus8 handpiece can really resurface and tighten the external skin. You can imagine if you tighten just internally, the surface doesn't change. By using Morpheus8, now we're hitting the skin from underneath and on top to really shrink wrap the skin in the way that we want. I always say that this modality is half of a facelift, in the sense that you don't have the scars, you don't have incisions. It's half of the facelift in the sense that it's half the side effects, it's half the downtime, it's half the duration of time it takes to do it, but it's also half the results and half the cost. So that's a good way to think about it. Although I tell my patients the results are dependent on from a person-to-person perspective. In surgery, I can control how much skin I excise. In this case, by controlling temperature, I can't exactly know how much skin tightening happens, but we always see good results with the modality. That being said, let me just move on quickly to the areas that I can use Facite on. Obviously, the name it indicates the initial use it came out for, but over the years, the use has expanded. We use it along the jawline. I use it along the mid-face to create that mid-face hollow. I use it underneath the eyes and the nasolabial folds to tighten the skin. I use it in the upper lid to tighten that skin if we're doing a non-surgical eyelid procedure. We can use it to affect a non-surgical brow lift. But aside from the face, we can use it in the brow bulge, in the small areas of fat on the abdomen, in the sagging skin of the arm, especially if there's been weight loss and that area of skin doesn't respond. And we can use it in just any small area that we need a little bit of fat remodeling and skin tightening. The area above the knees is another very popular area we use it for. It's a great technology, but just like any technology, we have to make sure that it fits you, because the whole concept is a bespoke, customized treatment that fits your face. If you have any questions, make sure you shoot them my way. We'll be happy to answer them.